Hi, in this short video we're going to talk about some of the things you should look for in reading a systematic review and run through that process very briefly in the context of this paper on technology-delivered cognitive behavioural therapy for pediatric anxiety disorders. So we're going to run through a series of questions which are a useful framework that you can use when you're reading any systematic review. The first and most important question is, what were they looking at? What is the question of the review? This should be clearly focused on patients' interventions and outcomes. We need to ask, did they look for the right types of studies? So the studies that address those questions with the right method. And we would ideally like to see the protocol for the review published in advance. So we can't do any of the outcome switching or selective reporting. We need to be assured that the reviewers found everything, that they didn't miss any studies, as we saw at the start, and we need to make sure they only included stuff that's high quality. So the GIGO principle there of garbage in, garbage out can apply. So if the underlying studies are biased, then the review is likely to be biased. And finally, the all-important question: does it make sense to combine all these different studies into one estimate? Helpfully, there's a checklist produced by the Critical Appraisal Skills Programme that you can run through to help to guide your thinking when you're appraising a systematic review. And these are the questions we'll be answering today. So what did they do in this study? Well, a first step is to look at the question. And here we've pulled out the key features of the participants, young people less than 18 years of age, that meet the criteria for any anxiety disorder on a structured diagnostic interview. So that's quite a clear and specific definition of that population group. We might talk about different ages and things like that, different aspects of the population, but that gives us quite a clear starting point. The interventions, it's maybe slightly harder to be exactly sure what's going on, but what we looked at here was cognitive behavioural therapy delivered primarily by digital means via an internet app, cell phone, tablet or computer. And there could have been different amounts of therapist involvement or caregiver involvement in those programs. So there was lots of different programs, but they were all under this heading of TCBT. We also looked at different comparisons, studies with slightly different comparisons. Some of them gave the control group treatment as usual, some of them put them on a waiting list, and some even had a psychological placebo intervention. So that's what TBC was being compared with: treatment as usual, waiting list, or a placebo. And in this case, the reviewers focused on a primary outcome of remission of the anxiety disorder, again defined by diagnostic interview, so that's quite good, using the same sort of method before and after. And the outcome was measured immediately after the treatment course was completed. So a key question, of course, is what do we mean by TCBT? And TCBT is actually a new acronym on me. This type of CBT has been described in lots of different ways in the literature, and you can see from this wall of words, which is taken from the literature search the reviewers did, they worked pretty hard to make sure all the possible ways of describing that intervention were included in their search. So that gives them a good chance of finding all of the published material that's relevant to our question. With also looking at the review, we've got a pretty clear flowchart of everything that they did as they went through their search, which records were included and excluded, and some of the reasons why certain papers weren't included. So we ended up with 9 studies with around 700 patients to work with. And that's quite a small number, given that we're looking at all of the studies that might have been done. But I think in this case that's probably because we've got that very specific focus on people with a diagnosed anxiety disorder. We also need to think about the quality of the studies that they included, and how they went about finding and including the studies in the review. So one of the key features we look for here is that you have 2 different people making those decisions, because one person might have some bias in themselves. It can be a tricky decision to decide whether to include a study or not, and what its quality rating should be. So one of the good things about this review is that we can see that 2 different reviewers carried out these tasks and then they compared the results. So that's what you might think of as blind and independent reviewing, and they used a consensus method to resolve any disagreements. So that gives us the best chance of having a reliable evaluation of what's relevant to include and what the methodological quality is of the stuff we're including. And so, very quickly running through that checklist, here's how I evaluated the study. One of the key things to talk about, we've already mentioned the different types of intervention, but another issue was with the way this systematic review was done. It was commissioned based on the PICO being defined, in this case, by the Swedish government. So it wasn't like other academic systematic reviews which start off with the protocol and then run through that process. If you like, the protocol was defined through an invitation to tender, if you like, from the Swedish government, who wanted to find an answer to this question. So it's kind of that's why I put this sort of not quite sure about that question at the start of the checklist. But otherwise, we had quite clearly defined patient populations and outcomes. The authors looked for the right type of papers. They looked for randomized trials relevant to the question. They worked quite hard to make sure they found all of the published evidence in the databases that they searched. And as we've seen, they did quite a rigorous assessment of the quality of the evidence that was included. We still do, I think, have a little bit of a question mark as to whether it makes sense to combine the studies. They found some evidence for heterogeneity in the results, and also, as we've discussed, what actually is the CBT intervention is quite hard to tell from research. It's not the reviewer's fault, it's because of the way that we write up these kinds of studies. It's quite hard to tell sometimes what exactly went on. So a quick look at the overall result, though, shows quite promising findings. The studies that looked at the primary anxiety disorder outcome were quite consistently finding in favour of TCBT, although there's quite a wide range there in what that overall effect might be. But the odds ratio of 4.73, that's roughly speaking, people who received the CBT were 4 to 5 times more likely to achieve remission at the end of the treatment compared to the ones who were in the control group. So it looks like there's some sort of effect happening here. Another just kind of little question mark to raise is we can see from the funnel plots that presented here a little bit of asymmetry. So the studies are slightly unevenly distributed around this overall finding of 4.73. That might suggest there could be publication bias, so there could be some studies that have been done but not been published. So are these results important? Well, I think they probably are. I don't think that there's results that we can ignore. But I think the thing to bear in mind is that we're talking about short-term outcomes, and the comparison is an inactive treatment, if you like, a control group or a waiting list or whatever. And looking at the quality of the evidence, the reviewers concluded moderate certainty of these results, and they identified evidence of heterogeneity. So there's some issues with bias in the underlying evidence, and we can't do anything about that now, retrospectively. So these are things we perhaps need to be a little bit cautious about. So my conclusion from reading this review was that it's a well-conducted review. It found some short-term benefits of TCBT in young people with anxiety disorders, but again, the comparison was doing nothing, effectively, and we're perhaps not 100% clear what are the active ingredients in that TBC. What is it that makes the difference? Why are some things better than others? There is a bit of risk of bias in the underlying trials. We perhaps need to do more about the reporting of these studies to make sure that they're more methodologically reliable. And we need to gather evidence on longer term effects and potential adverse outcomes, none of which were looked at here. So that's my lightning review of Cervin et al.'s systematic review. I hope you found that useful, and back to the campfire chat.